Hello, everyone. Welcome back to Med and Me. Today, we will be interviewing Dr. Gary Simonds, who is a neurosurgeon. Dr. Gary, thank you so much for having us today.
Thank you for having me.
So, before we get started, just some general questions. What is your doctorate type or your education type?
I have an MD from Rutgers Medical School. I also have a MS in Healthcare Delivery Science from Dartmouth.
Very nice. So, what is your specialty and where do you work?
So I'm a neurosurgeon by training and spent several decades in neurosurgery. For the last, 16, 17 years, I was the head of neurosurgery at the Virginia Tech Carilion System in Virginia. But I retired from surgery a couple of years ago, and now I'm teaching at Virginia Tech.
Very nice. So, what was your education to become a medical professional? Like starting from bachelor's to residency, like the time frame.
Yeah, this was way back in the 70s, and I was a biochemistry major in college. Also, religion minor. I actually, at the time, was thinking of going into the ministry, but eventually decided on medicine, and I went to Rutgers Medical School in New Jersey, and that, of course, is 4 years of schooling, pretty traditional medical school education, and went from there to neurosurgery residency, which is a 7-year training program after medical school, and I did that at Walter Reed in Washington, D.C.
Wow, very long time then.
It is a long time.
So, what was your motivation to choose neurosurgery?
Well, it's kind of a weird story. I think one of the things to understand is that a lot of people going into medical school know they want to be a doctor, but don't know exactly what kind of doctor they want to be, or they think they know what they want to be. And when they're exposed to different specialties during medical school, they may jump around on what they want to do. And that's exactly what happened to me. I originally was going to be a family practice doctor, and then I decided to be a cancer doctor, and then I decided I wanted to be a surgeon, and then a general surgeon, and then I eventually settled on being a cardiothoracic surgeon, a heart surgeon, and had my training all lined up after medical school. And then in the last month of medical school, I saw my first brain operation, and I just said, "Oh my God, I have got to do that. It's too cool and too crazy not to do." And so at the very last minute, I was changing horses in midstream, which is kind of crazy. I really didn't know what I was getting myself into, but I'm very glad that I did because I can't think of doing anything else.
That's wonderful. Such a great experience. Wow. Could you walk us through a typical day-to-day life as being a neurosurgeon?
Um, Day-to-day life as a neurosurgeon, at least in my experience, was very hectic, which I like. I mean, it was definitely an adrenaline rush. I tended to work at these big trauma hospitals, big medical centers with big trauma services, what they call level 1 trauma. So these hospitals where these helicopters are flying in all the time and the ambulances are coming in all the time. So in a typical day's work, you may have anywhere from 2 to 5 surgeries set up, but you may also be handling emergencies that are coming in into the emergency room and trauma bays, and or being called from the various other areas of the hospital. So usually I would get in to the hospital somewhere in the 5:30 to 6 range, see a bunch of patients in the ICUs because we had a lot of very sick patients, and then go to the OR. We would start surgery around 7 in the morning, and then some of our surgeries would take anywhere from 1 to 10 hours, depending on what the surgery was. But you would do your surgery and then get out and go see more patients, and then go back in after some time while they're preparing the room again. And this would go on usually well into the evening. So they were long, hard days, but it was definitely exciting.
So it's always so busy. Like you said, 10 hours per surgery. That's so exciting and like very long as well.
Yeah, I mean, not all surgeries go that long, and those would be some very big complex tumors or something like that. I'd say the typical brain surgery that we would do would last maybe 3 hours, something like that. But it varies tremendously with whatever you're treating.
Wow. So do you have like a certain experience in your career that changed your mindset? Like why did you choose neurosurgery? Like in general, just like any experience that sparked to choose neurosurgery? Because you said you jumped around from like different surgeries to like different residencies, and in the end you chose neuro. So
Yeah, like I said, I mean, it literally was just seeing the first brain operation. It just completely, it was like an epiphany. I was just like, I had to do that. But very quickly I was in the mix and realized how much I enjoyed it. I particularly like neuroscience and the brain and studying the brain. I mean, the brain is probably the most fascinating thing about us, right? It's
Yeah.
all that we do and think and how we behave and all that has to do with the brain. And so that's what you spend your time learning about. You never can get to the bottom of it.
Wow. Do you have any pros or cons for your specialty or your job?
Sure. I mean, there. I guess you could say there are many on both sides. I mean, the pros to me are that it is, as I said, it can be really an adrenaline rush. I mean, crazy things are happening. It's very much life and death. Emergencies are happening all the time. You're doing emergency surgery, running all over the place. Time goes quickly. You never get bored. It's very crazy.
Mhm.
You're also learning all the time because we don't know everything about the brain. We're not even close to knowing everything about the brain. So you're learning all the time. You take care of amazing patients and their families, and they are so very thankful for what you do. Particularly, if you give them your best effort and a order of humanity, and
Mhm.
I mean, just amazing patients, and it's technically very challenging. So you're always getting better. You're always learning how to do the surgeries better. The downside is that it's a lot of work. I mean, long hours, a lot
Mhm.
of work. Even the training is 7 years. And back when I did the residency, it was 110 hours in the hospital every week.
Wow.
And now it's 80 hours. You can't go over 80 hours, but it's 80 hours in the hospital every week for 7 years. And it is hard work, but and it's emotionally taxing because there's a lot of death and tragedy and that sort of thing. But you are truly on the cutting edge.
That's so amazing and like, wow. Wow, so many people can learn. Wow. Um, so what kind of person would you recommend this job for then?
Oh, we had to make these decisions on who we wanted because we had a training program. I ran a training program for neurosurgeons, so 7 years of training after medical school. So you put a lot of thought into the type of people that you want. What we found tended to be the people who did the best were people who were team players. They really wanted to be part of a team and understood that everybody on that team was very important. Even if you're the lead surgeon, there's all these various people who help you and support you, and you can't get it done without them. And that's multiple other specialists, PAs, nurses, nursing assistants, technicians, all that, all over the hospital. Really important. So we always wanted team players. We wanted people who were super kind and cared very much about their patients. So kind, caring people who really like other people. And we liked, it's a hard one to define, but we like people with what we would call street smarts, meaning, they didn't necessarily have
Oh.
to have absolute straight A's in everything or anything. What we really liked are people who, when presented with a new situation, a new problem, could figure their way out of it, could get their way out of trouble. Because in neurosurgery, things change and things happen very quickly and on a dime. So you really have to be able to adjust and adapt and figure things out. It isn't all perfectly laid out for you, particularly in the middle of a big operation or something. So we found that people who fit that bill seem to do very well. And of course, you have to be a hard worker and be willing to
Mhm.
kind of put in the hours. But again, it still goes way back to the kindness and the caring. If that's not there, you're never going to be a good neurosurgeon because people are very much depending on you.
Wow, I love how you explained that. I think that's really important for a lot of people to hear, especially in these circumstances. I love that. Do you have any particular tips for high schoolers in general to be a medical professional or to be in your specialty?
Yeah, I spend a lot of time with undergrads now, many of whom are oriented to medical school, and I think, and I also work with medical students a lot as well. So I see the whole gamut there. But it is a world of hard work, and you just have to accept that. But I think you have to keep yourself. You can't lose yourself in the hard work and the studies and all these activities that you're supposed to do. So one of the first things that I tell people is to try to get to know yourself, to actually spend some time before you kind of get on this hamster wheel of really running hard
Mhm.
for years upon years. But really kind of get to know yourself, know what you want in life, know what motivates you, know what makes you feel good, what makes you feel bad, how what you really want to do do for other people, to really kind of understand how you would fit into the medical world. Because ultimately, if you believe that you would be a great doctor and a great, if you want to go as far as neurosurgery or whatever you want to do, but if you feel that you you would make a really good doctor, then you must believe in yourself. You must believe that, that's there, that you have certain qualities that are going to make you very good at it. And that ultimately is what you want to sell. It's what you want to get across to the medical schools. You want to be yourself, and you want to be true to yourself, and not just kind of go in like a zombie and just do what you're supposed to do and check all the boxes, because ultimately I don't think you'll feel good. I don't think you'll enjoy it. Whereas if you're true to yourself and you you do what you're supposed to do, but it's always congruous with or congruent with what you are and who you are, it'll go well, and then you'll be able to do everything. And I'll give you another quick piece. There's a tendency to kind of commit to a whole bunch of extracurricular activities,
Yeah.
which is all fine. And again, I would suggest, though, that you do the things that you're interested in, but you never want your grades to slip. You always want to do your best as you can in your classes. When you're back in high school, you have much more time to kind of experiment with who you are and what interests you and stuff. So in some ways, I'm talking more about when you hit college, but it goes fast. It kind of comes at you fast. So in college, I think it's really good, again, to understand who you are and what you're interested in. And if you're thinking medicine, it would be nice to get some experiences. Go shadow some doctors or do some volunteer work in a hospital and see, and kind of start getting a feel for it.
Wow, I think that's really important, especially for high schoolers and even college students in general. That's very well said. Thank you, Dr. Simons.
It's my pleasure.
So, would you like to tell us more about like what you do now? Since you're a retired surgeon, would you like to like have an insight of what you do in the present?
Sure. I retired a little earlier than I thought I would, because I had a neurological problem myself. I had a neurological illness that kind of
Oh,
caused some problems, I wasn't kind of at my max in terms of peak performance, if you will, which I always thought I owed the surgeons if I'm going to operate. I mean, the patients if I'm going to operate on them. So anyway, but for a long time I've been involved in teaching as well. So I teach classes at Virginia Tech in neuroscience. One of them is called Exploring Clinical Neuroscience, where we look at what you do in medicine for the nervous system, neurologists, neurosurgeons, psychologists, rehab doctors, that sort of thing, and we look at various diseases, and then we look at all the implications of what the healthcare world looks like, and what it's like to be involved in healthcare, and particularly in the neuroscience side. I have medical students classes as well at Virginia Tech, and we do a number of neuroscience type classes where we look at various cases. We present a patient and the problems that they're having and go over how you deal with it and stuff. But I also spend a lot of time working on burnout. And working with medical students in the realm of burnout, because burnout is so common, well, really everywhere in our society, but we're seeing a lot in medicine, even all the way down to medical school.
definitely. Wow, that's like a lot. You do definitely like a lot of things. That's very nice. Um, yeah, that's all we have for today. Thank you so much, Dr. Simons, for all of your motivational work and just educating us about neurosurgery and the pathway to becoming one.
Oh no, it is my pleasure, and I'll go back to one more thing, if I might, with the high school students, is if you want to become a doctor, then you should become a doctor. You should, orient yourself and work towards it. It's an amazing field. I don't regret a single second of it. It's crazy interesting, and
Mhm.
lots of opportunity to do good things. You never go to bed ashamed of yourself. You always are able to lay your head down on the pillow and say, "Hey, I did some good work today," and you should never count yourself out. So if you want to do it, you should orient yourself to doing it, and push yourself, and you'll be surprised at what you're able to do. So it's a tremendous field. I would always be willing to talk to anybody who's interested in it at length, and never count yourself out.
Thank you. Thank you for those inspirational words. Okay, guys, so
Like I said, it's my pleasure.
with that, we have Dr. Simons for our interview. Again, Dr. Simons, thank you for joining us today. We will see you guys next time.